Okay, I'm gonna start off with the room scan. Okay, and I don't have physical drug cards with me, but I do have all my tabs open, so I'll show you what's on each one. Just to, ooh. Okay, so this one is just the MAR. This one is the provider's orders. And then this one is warfarin for my drug card, digoxin, Percocet, furosemide, and the Tylenol 3. And then I also did write down lab values from that sheet. So I will just, hopefully, that's okay. Okay. There we go. Okay. So I'm going to start by stating nursing considerations for all my drugs. So for warfarin, some nursing considerations would be to monitor blood studies, monitor BP, assess for fever, rash, and hives, and then assess for needed dosage change. For digoxin, some considerations would be to assess the pickle pulse for 1 minute prior to giving, to make sure the pulse is not low, monitor electrolytes, monitor renal function, monitor EKG. For Percocet, some considerations would be to assess pain, central nervous system changes, allergic reactions, respiratory depression. For furosemide, some nursing considerations would be to assess fluid volume status, monitor electrolytes, assess BP for hypertension, and then keep an eye out for serious rashes. And then for the Tylenol 3, some considerations would be to assess pain, monitor patients for respiratory depression, and then monitor for development of abuse. Okay. So now that I did that, I'm just going to look at the lab values. So for the digoxin, the normal range is 0.8 to 2, and Joe Smith's level was 2.1. So that is too high, so we're not going to give the digoxin. The sodium normal range is 135 to 145. His was at 136, which is on the lower end of normal. And then same with potassium, the range was 3.5 to 5, and his potassium was 3.5, which is right on the low end of normal. And since his sodium and potassium are on the lower end of normal, and it is a diuretic, so it's going to lower these values, he might go under the normal range. So I'm just going to hold the furosemide and until I get further instructions from the provider. And then the INR, the normal is 2 to 3.5, and his was 3.6, which is above normal range. So I am going to hold the warfarin. So it is not toxic. All right, so now that I have my lab values, I'm going to go in and assess the patient to see if they're having any pain, if I need to give a pain medication. Hi, I'm going to be your student nurse. I'm just going to provide for privacy and do hand hygiene. Could you give me your name and your date of birth?
Joseph Smith, 10/5/54.
Okay, and do you have any allergies?
To sulfur and betadine.
Okay, and then I'll just verify your wristbands. Are you having any pain?
Yes.
Okay, and what would you rate that pain, and where is the pain?
3 and in my leg.
Okay. I am going to be getting you a pain pill.
Okay.
Are you able to swallow pills okay?
Yep.
Okay, so I will do that and I will be right back.
Okay.
And then I would do hand hygiene again. So now I'm going to first look at my provider's orders to see what Joseph Smith has available for meds. So for medication for pain, he has either Percocet or Tylenol 3. And I think for this one, I'm just going to do the Tylenol 3. And then I'm just going to verify that with the MAR. So going to PRN medications, making sure both are for Joseph Smith, making sure that they are both, that it has not been given yet. They're both the same dosage, 300 milligrams Tylenol, 30 milligrams codeine, and they're both able to be by mouth. And they're both for every 4 hours for pain rating of 1 to 4, and his was a 3. So now I am going to just get rid of that provider order, and I am going to get out my medication. So Tylenol 3. This is Tylenol 3, and I'm just making sure it's for Joseph Smith. 300 milligrams Tylenol, 30 milligrams codeine, which is correct. It's not been expired. It expires 12/20/35. Integrity of the package is good. And then it has not been given yet, so it's the right time. And it's the right route, as it is the by mouth. So I'm just gonna grab a cup. And then for my second check, I'm just gonna do that again. So the Tylenol for 300 milligrams, codeine 30 milligrams for Joseph Smith. Right time, it hasn't been given yet by mouth, which is the right route. And then it has not been expired, as it expires December of 2035, and the integrity of the package is good, so that is good. All right, now that I have my medication, I'm going to make sure to pull out this and then my drug card, and I'm gonna go give it to the patient. So I'm gonna pretend like this was already in here. Okay. Hi, I'm Leola. I'm back. I'm your sleep nurse. I'm just gonna provide for privacy again, and I'm gonna do hand hygiene again. Could you give me your name and date of birth?
Joseph Smith, 10/5/54.
Okay, and do you have any allergies?
Sulfur and betadine.
Okay, and then I just verify your wristband. I scan that, and before making sure I'm scanning the medication, I'm just gonna do one final check. And I don't need any PPE. I could if I wanted to when touching the medication, but in this situation, I'm not gonna be really touching it, so I won't need it. So for the, I'm just gonna make sure it's for the right patient. It's for Joseph Smith, which is correct. The Tylenol, 300 milligrams, codeine, 30 milligrams. So right dosage, the right route as it's by mouth. And then for every 4 hours for pain. And then it's not been given yet. It is not expired, as it expires 12/20/35, and the integrity of the package is good. So then I would open that and put that in there without touching the pill. So I'm gonna now pull out my drug card. This one. Alrighty, so for this medication, this is for your pain in your leg. It's just going to depress pain impulses that transmit to the spinal cord. Do you wanna say it back for education?
It gets rid of pain from the spinal cord.
Okay, perfect. And then some side effects that you may experience are dizziness, orthostatic hypotension, so low blood pressure when you stand up, so it might make you once again dizzy, and then headache, diarrhea, and abdominal cramps. Some life-threatening ones would be cardiac arrest, hepatic failure, and respiratory depression.
Okay.
But the main ones you'll want to worry about is that dizziness. Okay?
Okay.
Alright, and you said you're able to take pills okay?
Yep.
And I'll make sure to scan the medication with the wristbands. Let's see, what am I forgetting? So I asked you for, I told you side effects, I did you teaching. So I would make sure your head of the bed is raised up. And do you have any concerns before I give you the medication?
No.
Okay, perfect. So I'm just moving this up to make sure you're sitting up so your shoulder. Okay, and then I'll give you your medication with some water, as long as you're able to take it that way.
Take the medication.
Okay. Do you have any other questions or concerns with me while I'm here? Anything else I can do while I'm here? Okay. So I am just gonna make sure you're comfortable. I'm gonna lower this back down. Okay, is right there okay? Okay.
Good.
And then I'll make sure you have your call light. I'd make sure the bed is low and locked. Okay, so it's low and it's locked and the side rail is there. There's no risk for falls. And then I already gave you your call lights. So you just ring that if you need me, and I would do hand hygiene on the way out. 5 moments of hand hygiene are before you touch a patient, after you touch a patient, before any septic procedure, after coming into contact with bodily fluids, and after touching a patient's surroundings. And then I would put that I gave it in the MAR, the medication, and then I also chart in one note why I didn't give the other medications due to the lab values being out of normal ranges. And I believe that's all.